lymphomas are nothing but the cancerous tumors which originate from the lymphoid system in our body. These lymphoid systems, they contain the various cells, and normally they give us to the body protection from infection, bacterial, fungus, viral infection, as well as they can even prevent the malignancy. Children usually get very high-grade lymphoma. We call it lymphoblastic lymphoma. And they almost behave like a leukemia, blood cancer. So in children, when the lymphoma occurs, normally we call it leukemia, lymphoma syndrome. That means both. If you leave the lymphoma for some time alone without treatment, it will transform into the leukemia. So that's why in children, it is called leukemia lymphoma. While in adults, we get different type of the tumors. We call it large cell lymphoma or high-grade lymphoma. And in elderly, we get the low-grade lymphoma. So they are mature lymphoma. So that's why in elderly, it is known as the lymphocytic leukemia. However, there are a lot of theories on what is the cause of lymphoma. Nobody exactly knows. But it's supposed to be some sort of rare viral infection. And that can cause particularly the infection like EBV virus, Epstein-Barr virus, that can cause the lymphoma. But not in every patient. It is also very common in patients who are immunodeficient. So patients who are immunodeficient, the incidence of lymphoma is very high. Similarly, post-transplant, after the kidney transplant, liver transplant, bone marrow transplant, because their immunity is very low, so all these people are highly susceptible to the lymphoma. Normally, these patients present with one enlargement of the lymph nodes, which may not be painful also. They just see some swelling in neck, axilla, groin, or abdomen. But sometimes they present with the symptoms. The common symptoms are fever. They have a prolonged fever for many weeks and months. Then they have a loss of appetite, loss of weight. So these are the, and whenever something like this happens, we always take X-ray chest, sonography of abdomen, and ultimately CT scan and PET scan. There we find the lymph nodes. And once you find the lymph nodes, you do the biopsy and get the diagnosis. This is one disease, highly curable. So whenever the diagnosis of lymphoma happens, we always tell the patient that you have a very high chance of total cure. In children, 95% of them get cured. In adults, like all this low-grade lymphoma, patient lives for many, many years, 10 years, 15 years, 20 years. So this is one disease which is highly curable with a very specific and good treatment which is available.